So good morning ma'am, I am Ashley J. Alvaran from BSN 1B. And today I am going to demonstrate occupied bed making. Before we start, first, what is bed making? Bed making is a technique of preparing different types of bed for patient that is suitable for his or her position for a particular condition. It is a process of making neat and clean for the client's bed. What are the purposes of occupied bed making? First is to change wet or soft beddings for the comfort and safety of the patient. Second is to provide a change of position and to afford an opportunity to inspect the client's body. Third is to minimize the source of skin irritation. And lastly is to provide a clean environment for the patient. There are also special considerations in occupied bed making that we have to remember. First, before starting the procedure, see to it that all linens is on hand and arranged according to use. Second, if the bed is on the high-low type, adjust the height accordingly to prevent the patient from having back pain or any injuries. Third, finish one side of the bed at a time. We must also remember that placement of the rubber sheet will depend upon the client's need and the client's condition. And lastly, we must apply the principles of body mechanics while making the bed or performing bed making. So now, before proceeding to do bed making, we need to gather first all the equipments to be used. I have bath blanket, that is a flannel covering used to prevent chilling when administering a bed bath. A bottom sheet that is used to cover and protect the mattress. A draw sheet that is used to protect the bottom sheet from soiling due to patient secretions and prevent the patient from getting bed sore. A top sheet that is used to cover the patient warm made of thick cotton and thermal material. Pillowcase, a removable cloth that is used as a cover for a pillow. And lastly, the hamper for soiled linens. Before we enter to the patient's room, we need first to assess the client's activity order to check the physician's order for any movement restrictions. Next is check all the linens and do the proper hand hygiene. After that, gather all the linens and arrange it according to use. After doing all that, we will now proceed on entering the patient's room. Good morning, sir. I am Ashley Alvaran. I am going to be your student nurse for the day. I am going to change your linens or perform bed making. Is that okay with you, sir? May I know your name and your birthday, sir? Nice to meet you, Sir Jed. After introducing myself to the patient and verify the patient's identity and also explain the procedure, we need to provide the patient's privacy next. After providing the patient's privacy, next is we will now proceed on removing the soiled top linen. We will loosen it and remember that this top sheet is stuck at the foot part. After that, we will now get the bath blanket to cover the patient's privacy and to maintain the patient warm. Next is, I will instruct Sir Jed. Can you please hold on to this top edge? But if the patient is, for example, unconscious and could not grasp the top edge, we can at least put this one and tuck it under the shoulder of the patient. But right now, Sir Jed is conscious and he can hold the top edge tightly. What is the purpose of this bath blanket? The purpose of this is to cover the patient while I am removing the top linen. Grasp the top edge of the top sheet and pull it towards at the foot part. And place the soiled top sheet in the hamper. Next is we will now change the bottom sheet and the draw sheet. But before we do that, I need Sir Jed to cooperate with me and listen to my instruction. I need Sir Jed to come closer near my side so that there will be an adequate space away from my side right here when I lag roll him towards to that side. I will move the patient per segment because the body of the patient is divided into three: the upper segment, the middle segment, and the lower segment. Sir Jed, I will move you a little bit to this side, and also to this side. Now that the patient have an adequate space away from my side right here, I can now lag roll the patient as one unit. But before we do that, I need to cross over the other feet of the patient like this, and the hands of the patient should be positioned as well. After doing that, make sure that the bed is raised to a good height. Next is, I can now lag roll the patient so that I can now work on the left side of the bed near me. Okay, sir, are you ready? At the count of 3, I will roll you over to your right and you will grasp to the railings for your support. Okay? 1, 2, 3. After doing that, we should be careful in keeping the body of the patient covered by the back blanket. And then you see if the patient is uncomfortable with his position in his head part. That's why we need to adjust the pino of the patient. And remember that, do not roll the patient to the other side without making sure that the side rails are out. The next thing we need to do is to loosen the bottom sheet and the draw sheet. And roll it towards the center of the bed under the patient. So now, remember that I have already touched the soiled linen. That's why I need to change with the new gloves, because if I use the same gloves to touch the new linen, I will just contaminate it. After changing with the new gloves, I can now get the new bottom sheet and spread it on the side of the bed near me. After spreading it from foot part to head part and pull out the excess towards me, we can now do the fan fold like this. Towards the center of the bed. After that, tuck the excess bottom sheet to the head part. After tacking the bottom sheet to the head part, next is we will now miter the corner. Assume the measuring that this is 12 to 18 inches, like this, and make a triangle. After making a triangle, tuck the excess part to the bottom of the head. And pull back the triangle down here, and tuck all the excess part alongside of the head. Next is, we will now apply the draw sheet and make sure it will catch this area, from the lower back of the patient to the upper thigh of the patient. And start folding. After that, we will now make a reposition of the patient to the center of the bed. Okay, Sir Jed, are you ready? I will now put you back at the center of the bed, okay? At the count of 3, lie your back, okay? 1, 2, 3. Then we need to put the side rail here on his right side. After putting the side rail here, I will now go to the other side of the bed away from me. And then I will now put down the side rail here because I will continue the procedure here. Okay, Sir Jed, I will move you again on the center of the bed. I'll move you a little bit. 1, 2, 3. 1, 2, 3. 1, 2, 3. We also need to do again the crossing over of the feet. Like this. And position the hand as well. And then log roll again the patient. Okay, Sir Jed, are you ready? At the count of 3, okay? 1, 2, 3. And then adjust again the pillow of the patient. Making sure that the patient's butt blanket will always cover to maintain the dignity and the privacy of the patient. After that, we will now remove the served linens on this part. And roll it away from me. And place it on the hamper. After that, we need to remove the gloves again because I touch again the served linens. Now that I wear the new gloves, I can now pour the linens layer by layer, starting first with the bottom sheet. And tuck the excess part at the head part. And then miter again the corner. Making a triangle like this. Tuck again the excess part. And then tuck all the excess part along the side of the bed. Next is the draw sheet. And if it is long enough, we can tuck it again at the bottom of the bed. After that, we need to make a reposition again to the patient back to the center of the bed and apply the top sheet. Okay, sir, at the count of 3, I will put you again back at the center of the bed. Okay, 1, 2, 3. And now that the patient is back to the center of the bed, adjust now the butt blanket. After that, we will now apply the new top sheet. And then put back the side rail. After putting the side rail, we will now remove the butt blanket. But before doing that, I need to instruct Sir Jed. Can you please hold on to this top edge and remove the butt blanket carefully. And put it on the hamper. Next is tuck the top sheet at the foot part by gently lifting the mattress. And then miter again the corner. You don't need to tuck all the excess of the top sheet alongside the bed. Just leave it like this. And then miter also the other side. After that, sir, I will remove your pillowcase for a while to change it with the new pillowcase. After removing the self pillowcase, remove again the gloves. We can put on the new pillowcase without the gloves. And place it again on the patient. But remember that the open edge should not face the door. And the last thing we need to do is to ensure the client's safety. When we are done with the patient's side rail should be up. And the height of the bed should be in a lowest position. And lastly, place the side table within the reach of the patient. That would be all for occupied bed making.